Frontotemporal dementia, FTD, is a type of dementia that primarily affects the frontal and temporal lobes of the brain, which are responsible for personality, behavior, decision-making, and language. FTD can be particularly challenging to diagnose early because its symptoms often resemble normal aging or other mental health conditions. However, there are some key early signs to be aware of. Early signs of frontotemporal dementia. Personality and behavior changes. One of the hallmark features of FTD is a significant shift in personality and behavior, often becoming more noticeable to family and close friends. A person may start acting impulsively, making socially inappropriate comments or taking risks they wouldn't have before. They may seem indifferent to the feelings of others or have difficulty recognizing or responding to emotions appropriately. They might make uncharacteristic or poor decisions, such as spending money irresponsibly or engaging in risky behaviors. They may lose interest in activities or hobbies that they once enjoyed, and seem emotionally flat or disengaged. Difficulty with social interactions. They may become socially inappropriate and make off-color jokes or fail to pick up on social cues. They may begin avoiding social events or become more isolated, not because they're shy, but because they don't feel motivated or don't understand the importance of social connections anymore. Speech and language problems. Early on, this could manifest as difficulty finding the right words or forming coherent sentences. There might be a tendency to speak in simple sentences or use fewer words, and sometimes, they may struggle to understand language as well. The person may use improper grammar or omit important parts of speech. For example, they might say "go store" instead of "I'm going to the store." They may also repeat words or phrases, sometimes without realizing it, or repeat someone else's words, often without understanding. Motor symptoms. While motor symptoms are typically more prominent in another form of dementia called Parkinson's disease dementia, some individuals with FTD may also experience motor difficulties such as clumsiness, tremors, or stiffness. Difficulty walking, balancing, or performing tasks that require fine motor control, like buttoning a shirt or typing. Muscle weakness or rigidity may occur in some subtypes of FTD, especially in cases that develop later in the disease. Compulsive behaviors. This can include repetitive actions, such as hand-wringing, clapping, routines, or rituals that they feel compelled to repeat, even if it's disruptive. A preoccupation with a certain topic, item, or activity, leading to rigid thinking or obsessional behaviors. They may start hoarding items or developing fixed ideas that are difficult to change. Changes in emotional responses. They may show little or no emotional reaction to events that would typically provoke feelings, like a death or a surprise. In some cases, emotional outbursts, such as laughing or crying at inappropriate times, may occur. They may struggle to interpret facial expressions or tone of voice, leading to responses that seem out of sync with the situation. Poor insight into changes. One of the frustrating aspects of FTD is that the person may not recognize the changes in their behavior or abilities. Unlike Alzheimer's disease, where people often notice memory loss and confusion, people with FTD might not realize they're acting differently. Types of frontotemporal dementia. FTD is not a single condition but rather a group of related disorders. There are different types, and the symptoms may vary depending on which part of the brain is most affected. The two main subtypes are behavioral variant FTD, which primarily affects behavior, personality, and social functioning. It leads to the significant behavioral changes we've discussed, such as apathy, disinhibition, and impulsivity. The second subtype is primary progressive aphasia, PPA, which involves language deficits. It can present as difficulty speaking or understanding language, as well as problems with word finding and sentence construction. There are two types of primary progressive aphasia: non-fluent variant PPA, characterized by difficulty with speech production and forming grammatically correct sentences, and semantic variant PPA, characterized by a loss of understanding of the meanings of words or objects, along with significant impairments in naming. What to do if you suspect FTD? If you or someone you know is showing signs of FTD, it's important to seek medical evaluation as early as possible. A neurologist or a geriatric specialist can perform cognitive and neuropsychological tests to determine the cause of the symptoms. MRI or CT scans may be used to assess brain structure and look for areas of atrophy in the frontal and temporal lobes. In some cases, genetic testing may be considered, especially if there's a family history of dementia. Neuropsychological testing can help assess cognitive function and rule out other conditions, such as Alzheimer's disease or psychiatric disorders. Early diagnosis can help in planning for the future, managing symptoms, and providing appropriate care and support.